My original cardiac arrest was in December of 2008. I was okay for about 6 to 7 months, and then my health started going downhill. I had multiple arrhythmias.
So my relationship with Brian began about 3 years ago when I met him in a special pacemaker clinic. He was not able to drive because he had received multiple shocks from his defibrillator, but he was still quite motivated to continue his life working and being active. So he chose to take a 2.5-hour commute to work each day, where he would walk for 3 miles and take the T the rest of the way.
In June of 2011, my doctor decided that it was time to start evaluating a heart transplant. In July was my first official appointment for heart transplant evaluation. So on November 2011, I was officially listed with Mass General Hospital as a level 2 on the heart transplant list with UNOS. I had gone in for a normal catheterization in January of 2012. When I got there, I found out that my heart wasn't squeezing enough, so they had to put me on IV Millerone and move me into the ICU. However, when we got to the 4th day, my blood pressure dropped. There were 2 solutions for me. Number 1 was you can stay in the ICU until your transplant and be on IV Millerone and IV dopamine for the blood pressure, or you can have an LVAD.
An LVAD, also known as a left ventricular assist device, is a heart pump. And it's for people who have heart failure due to a weakened heart. And what it does is it allows the blood flow that is unable to be pumped through the heart to be bypassed. And it's able to go through a rotary pump so that the person can actually maintain adequate blood flow to their organs and to their tissues without having good heart function.
Because the LVAD was going to free me up a lot more physically and get me out of the hospital, and it took care of your organs, I decided to go with the LVAD.
Brian was the perfect candidate for this procedure for a lot of reasons. One, he was sick enough. He was in an ICU for a number of weeks on multiple medicines to help him stay alive, to help his heart pump. So first off, he was sick enough.
And the purpose that I have an LVAD for is called BTT. It's a bridged transplant. And in a lot of cases like myself, we're in phase 4, we're in the last part of your heart's life. So they use an LVAD to extend your heart's usage and be able to bridge time.
With the shortage of donors and the long wait times, we know that in a particular population of people who are waiting for transplants, they won't survive. And with the advent of these new pumps, the left ventricular assist devices, we're able now to keep people alive while they wait for their hearts. It could be months, it could be years before Brian gets his transplant. And our job as his caretakers is to make sure that he can survive while he waits and he can still have a reasonable quality of life. And the LVAD allows him to do all of that.
What the LVAD's done for me is it's given me a lot of wind back. I joke and say I can do stupid pet tricks now. I can walk and talk at the same time. I haven't been able to do that for almost 2 years. So the LVAD has helped me leave the hospital and then manage myself outside the hospital as best I can. I soon will be able to drive. Now, I haven't been able to drive for 3.5 years. I get around pretty well on my own now. I'm starting to gain more stamina.
Brian was certainly able to handle the pump from an intellectual standpoint, an emotional standpoint, a physical standpoint. So having these pumps, it sounds like it's an easy fix, but it's really not. It's a lot of responsibility on the patient's end. The patient really has to know and understand the device, understand when something's not working right, because if the device malfunctions and one doesn't know how to respond to that malfunction, that could very quickly lead to a person's demise.
The downside to the LVAD, there are a couple downsides. First of all, you have to meticulously keep your eye on all the components. There's a battery, there's the net systems controller on the outside, and if they slip at any time, they can cause pain and trouble to you. I've had that happen once, changing my clothes. My net systems controller fell on the ground, which caused a lot of pain, and I was concerned at the time. Once it moves or falls, it pulls on the drive line and it can move the pump. And if it moves the pump, it can be a major problem. Luckily, it was caught in time and there was nothing major that happened to it.
I think the most difficult part of the transplant process for a patient is the frequent office visits, all of the tests that are involved. Some of the tests that are involved will require that the patient undergo invasive procedures, biopsies, things of that nature. So it really takes a huge commitment on the patient's part to come in frequently for their visits, to go through all of the testing process. And then after that, it can be very difficult when you're in the waiting process, because people wait weeks, sometimes years, for their transplant.
Once you get an LVAD, your transplant status automatically goes to 1B. And 1B there's a higher incidence of getting a transplant than 2s. It's very hard for 2s. There's so many of them. With the 1B, you're on call. You know, it can happen at any time.
It's a huge emotional toll that happens with an individual. Waiting, wondering if today is going to be your transplant day or if it's going to be your last day. And so I think as a physician, it's really hard to convey what that's going to be like to a patient when they initiate the process.
My sponsor that was given to me by Mass General, Frank, has been through a transplant. He helped me through a lot of the what to expect for it, with it, and also what kind of things to watch out for.
So Brian has made us all so proud through this entire process. Brian has been very committed to his own care and being dedicated to understanding his LVAD, understanding the transplant process, and most importantly, he's been really focused on giving back. And not only giving back in a way that he can help by doing things like fundraising, but he's also dedicated his time to talking to other patients and educating other patients about his experience and educating them about the VAD.
What are my current goals and how have they changed? I now want everything. Before it was just skiing. Now I want my workout back and my skiing back and everything else I was able to do back. I'm realistic in that it probably won't happen, but I'm also unrealistic in that I'm hoping for it. There are a lot of things that I haven't been able to do for years, so I want all that back.